Back after halftime, your third quarter brought to you by Auto Glass America. Crack windshield, free windshield replacement with proper insurance, and they'll buy back your old windshield on the spot for up to $100. Lifetime warranty, and they're mobile. They'll come to you, 813-96-GLASS, 813-96-GLASS. The man to my left, up in the style on the set here, Dr. Kevin Kaplan of JOI, one of the Jacksonville Jaguar team physicians. Here to talk injuries, and thanks for coming, Doc.
Thanks for having me. It's good to be here.
Dr. Kaplan's going to give you the lowdown on some of the guys you own, maybe some guys that you should be taking a look at because of these guys that are injured. And I want to start with Fred Jackson. Very unfortunate. Last year he was injured. He came back this year and was looking good in the preseason. Sprains his LCL. They say 2 to 4, but what can people expect?
So the LCL is one of the ligaments in the knee. There's 4 main ligaments. The LCL is the ligament on the outside part of the knee. It connects the femur to the bones of the lower leg. It's not like an ACL. When you tear it, you're done for the season. It's one of those ligaments that can kind of stretch. You can get some partial tears in it. And it really depends on how stable his knee feels to the physicians and to him. So I'm assuming they got an MRI, which is something that we would do as well for our athletes. And if it just looks like the ligament's stretched, then as soon as his pain goes away and he feels comfortable with his leg, then he should be able to get back. So that's where the 2 to 4 weeks comes in, because they're going to rehab him, they're going to push him along in practice and see how he feels once he gets back out there.
The injury last year, I mean, from a stability standpoint, can that make it any weaker and closer to the 4, or does that not affect it?
Not really. As long as, ligaments take, on average, several weeks, 4 to 6 weeks to get their normal elasticity. So as long as he does not have any residual instability, it shouldn't have an effect this year.
Jeremy Maclin, Michael Vick needs his receivers. Deshaun Jackson's there. Jeremy Maclin has a hip pointer, and he's very questionable. He hasn't practiced this week, maybe a little bit on Friday, very light. Where do you put his chances to play?
Hip pointers are one of those injuries that, again, is something you can very well play through. It's just extremely painful. You get a hit right to your pelvis or right to the area where your abductor muscles, those are the muscles that help to bring their leg out and bring the leg back. If you get an injury to that, it's extremely painful. And when these guys are trying to run, it's very difficult for them to plant sometimes. So usually for those types of injuries, we rest them, put them on anti-inflammatory medications, and if they feel good enough, they can get back out there. He's a competitor, so I'm sure he's going to be out there this week.
He's a competitor. Pierre Garçon, 100 yards in the first quarter, caught the long touchdown from Robert Griffin III, his first touchdown of his career, then goes out with a foot. They're saying it's similar to turf toe, but it's in the foot. Turf toe, from what everyone says, is extremely painful.
It is extremely painful. Turf toe, when these guys try to, again, plant and push off and try to push forward, they're really torquing on their toe. So if he injured either a ligament or soft tissue in the toe, it may make it very difficult for him to push off and try to, reach out and grab a ball or something like that. So one of those difficult ones.
And check his status before you put him in the lineup this week. They are at St. Louis, so it is a good matchup if he's playing. Jake Locker injured his non-throwing shoulder. Obviously, he was putting up 230 yards against New England, so he was on pace for a good day. Non-throwing shoulder, can he get out there and play against San Diego?
I think he could very well get out there and play. It's not something, obviously you still are torquing and moving your shoulder when you're throwing with the opposite side, but for a non-throwing shoulder, whether it be a little bit of instability, you can brace it, you can try to give him some anti-inflammatory medications to cool down that inflammation, but he should still be able to throw the ball. So.
All right, as we wrap up our injury segment here with Dr. Kevin Kaplan of JOI, want to get into David Nelson from Buffalo. Again, another Buffalo injury, tears his ACL. But I wanted you to put in perspective from what you saw from Adrian Peterson against this Jacksonville Jaguars team. He tore his ACL and MCL and was back in, 8?
It was quick. It's probably the worst thing to happen in my practice because all these kids come in, tear their ACLs, and they say, well, I can get it back there as quick as Adrian Peterson. Typically, on average, if you look at all the orthopedic literature, it takes a little bit longer than that usually, 9 to 10 months to get back from an ACL injury, but some guys do it quicker. So, it's something, he's taking a risk getting out there that quick, but, he's a professional athlete and is extremely strong. But on average, it takes a little bit longer to get back. It's a season-ending injury, unfortunately, most of the time, and unfortunate for him.
And we're going to have Dr. Kevin Kaplan all season. You have an injury question, Your Jacks Fantasy Football is where you can find us. Ask us the question for Doc Kaplan or JOI. Find Doc at 435-4356?
346-3465.
346-3465 JOI, one of the Jacksonville Jaguars team physicians. also orthopedic sports medicine. Doc Kaplan here every week. Mike Dempsey has your storylines for the week 2 coming up right after this. Dyslexia.